So here's my audience. Here is my outline and my verbal citations. And then also here is my visual aid. My name is Huddleston, and today I will be doing an informative speech for Speech 1311 about BRCA genetic testing. If you had the chance to determine your risk of developing cancer, would you take it? Well, today we'll be discussing a test that determines just that. Here are my 3 main ideas about the genetic testing that we'll go over. My first point is the definition of what BRCA genetic testing is and how is it done. Then we'll move on to some positive effects of being tested, and then lastly go over negative effects. So let me begin by telling you about what BRCA genetic testing really is. The test is a test that can determine if you carry a genetic mutation that is linked to particular cancers, such as breast cancer, ovarian, and pancreatic. The test can be done by a simple saliva or blood test in a local genetic counselor's office that you're typically referred to by your primary care physician or an OBGYN. This test can determine your actual risk of developing the cancers by a certain age. So those who test positive, up to 50% will develop breast cancer by the age of 50. Then by the age of 70, 87% will have tested positive, and also will have tested positive. 44% by the age of 70 will have tested positive for ovarian cancer. And according to the Journal of Genetic Counseling, breast cancer is the second leading cause of death among American women. Approximately 5 to 10% of all breast cancers are actually linked to inherited genetic mutations, of which BRCA1 and BRCA2. A positive BRCA1 or BRCA2 genetic test result indicates a higher risk for developing breast, ovarian, and other cancers. Now let's move on to discuss some of the benefits of being genetically tested. Doing the test, regardless if it comes back negative or positive, gives you the empowerment of knowledge. Typically, when a family member is tested, it prompts other family members to be tested as well, and also gives the empowerment of being able to pass on that knowledge to your children, because now your children now carry a 50-50 chance of also carrying the genetic mutation. And as stated by breastcancer.org, you may consider preventative surgical removal of your breast or ovaries before cancer has an opportunity to develop, which then lowers your risk of developing cancer. This preventative plan usually starts about the age of 25, so at any time you're able to start meeting with your doctor, usually about every 6 months, to lower your risk of not developing any types of cancer. So lastly, we'll be talking about some negative factors of being tested. Many medical professionals feel that you're putting your mental health at stake in light of your physical health, because any type of preventative measures do not actually lower or do not completely remove the chance of developing cancers. Also, a negative result is that they are pushing young adults between the ages of 18 and 25 to be tested when there are no medically proven plans that will help reduce their risk. As written by Hoskins and the National Society of Genetic Counselors, protocols for early detection and prevention among women for hereditary breast and ovarian cancer families may be ineffective for women aged 18 to 25, as no evidence-based, widely accepted management plans developed specifically for the youngest mutation carriers currently exist. As a result, these women may experience significant challenges in adjusting to their mutation status, leading to greater HBOC-related distress than an older mutation-positive woman. Also, preventative measures do not completely eliminate your risk of developing the cancer. So surgical management, such as removing your breast or ovaries, only lowers your risk 90%, still leaving a 10% chance of developing the cancer in your lifetime. So as I've just told you the information on BRCA genetic testing, I gave you information about what it is, how it works. Then I informed you on benefits of how it will affect you and also negative effects of being tested. The BRCA genetic testing was created to empower us and give us the knowledge that others did not have before us.